Welcome to Taking Healthcare by Storm Industry Insights, the podcast that delves into the captivating intersection of innovation, science, compassion, and care. In each episode, Quality Insights Medical Director Dr. Jean Storm will have the privilege of engaging with leading experts across diverse fields, including dietitians, pharmacists, and brave patients navigating their own healthcare journeys. Our mission is to bring you the best healthcare insights, drawing from the expertise of professionals across West Virginia, Pennsylvania, and the nation. Subscribe now, and together we can take healthcare by storm.
Hi, everyone, and welcome to another episode of Taking Healthcare by Storm. I am Dr. Jean Storm, the medical director here at Quality Insights. Today's guest brings together two worlds that don't often appear side by side, but perhaps they should. I feel they should. Dr. Christopher Peterson is a pediatric anesthesiologist who has spent decades caring for patients in some of their most vulnerable moments. He's also an ordained Buddhist priest, meditation teacher, and mindfulness counselor dedicated to helping people suffer less and live with greater clarity and compassion. His journey into meditation began with a simple curiosity about the mind and deepened over the years into a daily practice and spiritual calling. Today, he leads meditation groups, supports individuals through mindfulness-based counseling, and works to build accessible spaces for reflection and healing within the community. In our conversation, we'll explore how the teachings of the Buddha can serve as a guide for modern life, the role of mindfulness in medicine, the connection between presence and anesthesiology, and how meditation can help both patients and providers navigate pain, stress, and suffering with greater awareness. I am very excited to get started in this conversation. Dr. Chris Peterson. Chris, thank you so very much for joining me today.
Thank you, Jean. I'm looking forward to this.
Yes. As I said, you've built a career as a pediatric anesthesiologist while also becoming an ordained Buddhist priest. That's very unusual, I think most people would say. How did these two paths come together in your life? And what drew you from an early curiosity about the mind, as I mentioned in the introduction, into a deeper commitment to meditation and spiritual practice in general?
Oh, that's a great question. And Jean, let me just clarify. As a pediatric anesthesiologist, I did take care of a lot of children. I did a lot of time doing pediatric open heart cases. And when I came to a center that didn't offer those, I got more involved in taking care of the regular children. So I'm a person who's really comfortable, but I've not done like a formal pediatric anesthesiology fellowship. So in case any of my peers or other anesthesiologists want to call me out on that, I just want to put that out there for you to start. But yeah, I mean, I don't think these two things, the anesthesia part and Buddhist part, came together in a way that I felt your question was asking. But I think what happened was, I think the career of medicine and trying to raise children early in my life and have a relationship, I think I missed out on a lot of things. I was trying to be the best person I could based on, what I could learn about medicine, trying to be the best doctor, trying to be the best dad. And I mean, just to be completely upfront, what happened to me was I had like a little existential crisis. You might call it like a midlife awakening or something like that, where just out of nowhere, I'd say my psyche was just jarred in a way that I had never seen it coming. And I struggled a lot, like with kind of depression at that time, just trying to make sense of things. And I saw counselors, I saw psychiatrists, I saw marriage counselors. And the person that was most helpful to me was actually a Buddhist priest who was a psychologist also. And his ability to help me see how I'd missed understanding so much of my life and how to get myself back on track again was life changing. Probably the most significant thing that happened to me in my life so far. So, in a way, I think it was, and when I put it into the bigger picture of like the story of the Buddha, which we mentioned earlier, and maybe we can get into, is that I was suffering and I didn't really know it. I mean, I knew I was suffering, but I didn't know why. And as you might know, that the first noble truth of Buddhism is really like the suffering exists around us, and there are ways to suffer less is the second noble truth, pretty much. I was in a place, I think, created by my career, created by the work around me, created by the decisions, created by the ways that I had lived my life, thinking I was living them with clarity and wisdom. But really, I was probably just slingshotted into this career from an early age based on what my parents' expectations were, I happened to be good at science, math and things, and it was fairly easy to go through the whole training process. But like there were parts of me that were unexamined. And the teacher at that time had me pause. And that was when I really started meditating a lot more. I'd taken some transcendental meditation class. It was in college and did this, but it really wasn't that meaningful for me. And there was no real explanation about like why this would work. There's no psychology associated with it. But this experience with the teacher and how I started to learn more really gave me tools to deal with the challenges that arose in my life and in medicine. And that would
Yeah.
be, I know it's probably more than you expected there.
No. It's perfect. You mentioned the story of the Buddha, and you and I have kind of already have gone back and forth. If people listening are familiar with the story of the Buddha, but you've said that it can be seen as a metaphor for awakening to our own lives. So, how can that story serve as a practical guide for how people live, work, and, as you said, respond to suffering?
Oh my gosh, that's another really great question. And I think that, so to just take a step backward, the word metaphor is really important for me here. I'm probably what people would call a secular Buddhist. My training really was more in Zen Buddhism, which is very different, but related in a great way to the myth of the Buddha. But I guess it's a good fit for me. And it was what my teacher really introduced me to. And it's where I've taken it myself, like a Zen practice. But I think that to look at the story as a myth is stronger than looking at it as a literal story. I mean, myths are really clues about spiritual potentials of human life, and every culture has them. Some people take myths literally, but I find it more profound to take them metaphorically. So I think the way you ask that question is great. And that's how I would have. And I mean, there are a few things that the story of the Buddha really is about transforming ourselves. I mean, the Buddha, well, let's try to give you a real simple rundown and we can break it down more if you want. But the story of the Buddha was raised like a prince with his family, trying not to let him see the outside world because there'd been a prophecy about him possibly becoming a religious spiritual leader. And his father would rather have him not be that. He wanted him to just be a king instead. So he was kept from seeing a lot of pain and suffering, and he escaped at probably the midpoint of his life, you could say. So there's like an analogy there, and saw bits of the world and saw suffering, saw aging, sickness, death, and also saw like spiritual people wandering, and was drawn to those things with questions, trying to understand them more. And then basically followed these ascetics who basically basically at that time in that history were trying to separate their body from their soul. There was this idea that the more you beat up your body, the more you submitted it to fasting, to exposure to the elements, that, somehow it would weaken and the soul would come forward. And this was kind of, imagine the thinking around the time of the Buddha. And the Buddha did this for many years and really didn't have any big awakenings. But then after being exhausted and starved, he found himself sitting under a tree, and a goat herding girl basically brought him some rice and rice milk, they say, and taking that rice milk and sitting under the tree and basically meditating, he was able to see his connection with the universe. He was able to have this awakening. And there's a lot more to it. And he then chose to go on and into the world and teach and share these things. And it's kind of like a monomyth. Like if you're familiar with Joseph Campbell and the idea of a monomyth, and if people want to research that, it's kind of a cool thing. But a lot of myths have the same components to their stories. And so I think that the big thing is that the Buddha was drawn to suffering. And I believe that people in the healthcare profession are drawn to suffering too. I mean, really our kind of goal is to relieve the suffering and sickness of people. And, this is what we do. So I think there's an analogy there. One of the things my teacher taught me early on to when you're reading teachings of Buddhism is he used to say that he goes, if it has to do with the suffering or the relief of suffering, it is Dharma. It is the teaching of the Buddha. If it doesn't, it's just anything. So I believe that people will give you another little story, is that one of the big ideas in Buddhism, at least as I see it, is that we've been conditioned to see the world in a certain way. And all the experiences from our inherited psychology of just like our ancestors that had to hoard food or hoard things to survive. We have little bits of those things in us. In addition, we have our relationships with our mothers when we were little and how that formed us, and how whether mothers or a maternal figure was there for us or not, a paternal figure that taught us about going into the world and what the rules are, how our peers saw us, the things we were exposed to. All those things create a lens through which we see the world. And the reality of it is that everybody's lens is different, and probably none of them are really clear. It's all clouded by our experiences, our ideas. And the idea of a practice, as I teach it and see it myself, is that how can we see things clearer, and instead of always coming from a place of our own conditioning, come from a place of clarity, come from a place of wisdom, compassion. And this would be the shift that I believe a person takes. And to go back to the story, that sometimes we need to pause, just like a Buddha paused. And mindfulness gets us out of our own narrative, gets us out of the story that we're telling ourselves in our mind, which is based usually on our conditioning, and basically get to pay attention, to just notice things and take a step back. So not assuming that we know. And I think that translates into medicine a lot. There are things we know and we do have to make decisions, but sometimes we're so locked in going down a path that may or may not be right just because we've had experience or conditioning or exposure to that. So biases, things like that. One of the things too, I'll just throw in a little thing from Zen that it is like a practice that somehow relates to this a little bit. There are three parts to this. The wisdom of not knowing would be the first, where we are very curious about things. We don't pretend to know the answer. And that kind of translates into a beginner's mind, which you might have heard that term, where it's like if you've already In the mind of the beginner, the options are many because you don't know anything. So you hold all things interesting and as possibilities. In the mind of the expert, the possibilities are few because you've already narrowed it down, or so you think. So to embrace situations with this wisdom of not knowing. The second part is like what we call bearing witness, where again, you don't feel you need to intervene right away, but you are just present. You're accompanying somebody or yourself on the path without feeling you have to fix something. And I think in medicine, we feel we have to fix everything. And I think there's a lot of pressure to do that. There's a lot of pressure to write prescriptions. There's a lot of pressure to jump in or give advice. And sometimes people want that, but sometimes they just want somebody to listen. So this bearing witness. And then the final thing is compassionate action. So after sitting with those first two, being curious and not jumping to conclusions and not trying to fix things right away, you may see an opportunity to what is the most compassionate thing I can do at this moment. And it might just be to keep being present. It might continue to give somebody a hug. It could be anything. And I think in medicine, we deal with a lot of things where they're not great solutions to things, and just being there and supporting can be just really the right compassionate thing to do. I had another thought about this too, is that, the idea that I think in this story too, there's an idea the goat herding person, this compassionate action involved another person. It involved others. It wasn't just the Buddha sitting himself or going through all this process. And I think you could see that all the things that we can do might involve others. It might involve relationships we have. It might involve a mentor. It might involve a wellness program, like at a hospital that, helps somebody come out through on the other side of a process they're going through. So there's this idea that we all help ourselves along the way too, if that makes sense at all.
Yeah. Yeah. I wanted to kind of shift a little bit and talk about um, meditation and mindfulness and its place in with. I wanted to first ask about healthcare providers, and then I wanted to talk about patients maybe living with chronic illness and chronic pain. So, have you seen meditation and mindfulness reduce burnout and stress and emotional exhaustion among healthcare providers?
I have, and I've seen some of it in just myself, like my own personal experience. It has. I have started some groups at the hospital, and the people that came found them very helpful. And again, some of it is sharing common things, giving people a place to talk about things. Another thing I think is that having a mindfulness practice, again, takes you out of your head, allows you to pay more attention to what's going on and to be curious. And those things can touch your life in a lot of different areas. It can touch them at home. It can touch them with the way you're raising your kids. It can touch them with financial problems, sick parents, whatever you're dealing with. So it's not just about the work itself, but it's about like your life tends to be a little better, if that makes sense. Because as healthcare providers, you go to work all day, you get like this compassion fatigue, taking care of everyone else. And you come home and everybody at home wants you to take care of them too. And it's hard. So to have the ability to clear your mind a little bit, come back fresh, to not, to separate these things out and not, right away go into, what's the problem? Yeah. But being able to again sit back, bear witness to these things, find this peace. And I believe the practice of meditation, basically bringing yourself back to the moment when you're realizing you're having thoughts. I'll simplify it that much is that I think your brain, like new neural pathways are formed. And as they're formed, they become easier to activate. And this has been shown psychologically that just like practicing an instrument, the more that you do something, the more it becomes easier, and the neural pathways tend to fire, like nerves that fire together wire together, and you create a change, a shift from, for instance, going over things repetitively in your mind, telling yourself the same story, or if somebody does something wrong, or if you do something wrong as a doctor, you might beat yourself up, and that beating yourself up adds to the suffering, isn't really clear or helpful. So to be able to have a mind that's trained to more easily shift away and be compassionate, and it is very helpful, I think. I think these things are really hard to measure. And I think that's one of the problems, like in science and medicine, we want to measure everything and have metrics. And I think it's hard, like it's kind of like, you're happy some days. And, how do you quantify that? Or you find joy in things. But, so I don't think it's well studied to say, like, yes. I think you'll find a lot of soft data out there, but it's almost like if you try it, it usually works and you notice it yourself. So you want to continue to have the practice, or at least, you should be practicing whether you do or not. But if that makes any sense, maybe like exercise, like not everybody exercises, but when you do and you're doing it, you know that you're feeling better about your life in your body.
Yeah, and I think there are maybe there are eventually going to be ways to measure things, but perhaps, we don't have them right now, but that doesn't mean there's not benefit.
Yes.
Yeah. I wanted to talk about patients a little bit, and, individuals who are suffering particularly from chronic pain from a clinical perspective and a spiritual perspective, because you have both. How can mindfulness and meditation help individuals who live with chronic pain experience less suffering? So I know it's very hard. I've taken care of a lot of individuals with chronic pain, mostly in nursing homes, and it's very challenging to, to try to get people to maybe think about their suffering in a different way. So, can mindfulness and meditation play a role with chronic pain, even the pain itself may not change or go away?
Yes, I really think it can. Now, I don't want to minimize people's pain at all, because I think there is a physical pain. But beyond the physical pain, there's like a suffering that the mind imposes on top of that. For instance, the fears we might have about what this means, the stories we tell ourselves when we're having our pain. Is it going to get worse? What will my life be like? What's causing this pain? Will I ever be better? Those types of things. And instead of, again, telling the stories, maybe shifting to being more curious about it, noticing it, versus telling the story can be very helpful. It takes it as something separate, and it's this thing that's destroying your life. We want to tell ourselves over and over again when we're suffering. I also think stress in life can make pain worse. I mean, I've had that. You get some little bit of back pain, and it's a busy day, and you're running around, and it's crazy. Your back pain's crazy, but then you have a couple of days off, and it's so much better. So again, a practice that helps you deal with the other things in your life and look at them better can take away some of the stress. And in Buddhism, there's what they call like a second arrow effect, where like you have the pain, but then you have all the superimposed suffering from trying to get rid of it or wishing things were different. And like a little analogy that sometimes people have I use to help you see it is, for instance, let's say both you and I were going to have something painful happen to us in 24 hours. And, whether we know we're going to get a bone broken, or we're going to get a tattoo, but it's going to be done with a branding iron. And we both decide this is going to happen. We're told it's going to happen. It's like between now and tomorrow, we won't have felt any pain, but we're going to suffer a lot worrying about it and thinking about it. So we could get to that point, and then people are like, "Oh no, we're just kidding. This isn't going to happen." Be like, "Oh my gosh, like I ruined my whole 24 hours
Yeah.
not enjoying it, not being present." And this is how it would work for people that have the pain. Like you have the pain, but then you have all the suffering on top of it too. And I think that would be the mechanism how I would see that happening. I wanted to go back. Do you care if I go back to one of
No,
the
go ahead.
questions
Yeah,
about
no, go
work
ahead. Yeah.
and exhaustion? I've had one of the things I worry about with healthcare institutions is that sometimes they do these interventions for wellness with more of a concern for either the bottom line or just thinking that, okay, we're doing this to put on our checklist. And there is a concern from like a Buddhist community that sometimes these are not wellness programs aren't meant to change what is actually hurting the people or harming them, but to just be more like an anodyne or an opiate that says like, okay, now here you can manage this. So go back to work type of thing. And I think you have to be very careful about that, if that makes sense. So
Most definitely.
yeah, so I think like when you look at, and the other thing too is sometimes what I found, and this is sometimes like a shotgun approach, like people grab everything that is like maybe not mainstream health and say, okay, all this is somehow wellness. And I think those things are very different sometimes. People lump like aromatherapy. It's like along with something like a practice of serious meditation. I mean, and to me, those things are really totally different and unrelated, yet they always seem to get some things like that lumped together. So, those are just some observations, personal thoughts I've had about that.
Yeah, definitely. And also on social media, I think that happens. You know?
Absolutely. Yeah. Yeah. Like crystals or
Yeah.
pyramids or,
Yeah.
chakras or this or that. I mean, I don't pretend to know anything about those things and maybe a whole unexplored world, but to put it on the same at the same meeting at a wellness group for the hospital, it's like, wait a minute, we're not,
Right.
we're kind of all over the place here.
I just wanted to touch briefly and get your insights with AI because obviously it's becoming more integrated into healthcare and daily life. Like, you can do meditations with AI. And do you see a place for it in supporting meditation and mindfulness? I mean, I'll say just initially for me, I don't. For me, it's something that personally happens, outside of technology. But do you see a place for it in meditation or mindfulness? Or do you think, maybe like me, that it just must remain, human and personal?
It's a good question. And indirectly, I think it will. Like if AI automates things that aren't really value added time for us, and we could be freed up to focus on the things that are more rewarding, more patient, pure personal stuff, it would make the jobs more satisfying. Do you know what I mean? Like, so I think if it's used in that way, it can take away mundane tasks that might be irritating and contributing to our burnout. But then there's this idea I've been hearing about like technology driven deflation, where the benefits of the technology should really make our lives easier and better and be passed on. But if it's just, again, if it's integrated in a way, just like, okay, now we can take tasks from the doctor so we can make them see more patients, that's not going to be helpful. So I think AI needs to be integrated ethically. Clinician well-being should be part of the metrics when they do this, and transparency about if money's being saved by AI in the healthcare industry, how is it being distributed? Is it just going to the top and the companies and the insurance companies, or will the people on the ground benefit from this? Will patients benefit from it other than just, again, the financial side of this? I can say that I use AI a lot to learn about things. And I find it really helpful, like even to ask questions about Buddhism. Like I think it's a great resource when you want to drill deeper into things. I think we're really early in the, and I mean, maybe you're asking like a bigger question, like could AI help me meditate in a deeper way? But I've had AI make some interesting suggestions of things that I didn't see myself. And then I try to look at it in different ways. Like one thing I've asked recently is about like the craziness in the world, like you on the one hand, you want to rage about it. On the other hand, you're like raging about it is ruining my life. And if you ask that question, how can I deal with this? You get some interesting answers, and it kind of helps with suffering and the relief of suffering if it's used properly. But I think again, it's all, how we kind of use it. Are we going to squander it and make medicine more industrial instead of making it more humane? Would be a question, I guess, that I ask.
Yeah,
Uh,
yes. So, last question I want to ask you, and I ask this question of almost every guest. If you were given the opportunity to reshape healthcare in the United States, what is the first change you would make to better support healing and reduction of suffering and the reduction of burnout and stress and emotional exhaustion, for providers and patients?
oh my, Gene, that's a good question. And the healthcare industry is so complex. And that's one thing that's come to me a lot is more patient responsibility would probably be the thing I would try to change. And I I would think that like education from a very early age, but exercise, diet, mindfulness practices, those types of things, like from a really early age, integrating this into the system, more community resources for food, exercise, relationships. Sometimes I think about removing the middleman, the insurance companies and layers of administration, but I have no idea really how to do that. And I think being aware of how fast things are changing, like the dilemma of the impact of technology acceleration and screen time, and where's this taking us and how can we deal with it? But putting some of this on the patient, and I know that's not going to get rid of everything. But I think those are there'd be a lot of preventable things or early detection types of things that could be done in that area. And that's probably where I put my focus.
I love that. I hope that maybe we get there someday.
Let's do it together.
Yeah, I agree. So, if people want to find out more about you, do you have some place where they can do that? Learn more about what you're doing and your work?
I am sadly lacking that. I have a website that I haven't really done much with. If they have questions, I'd be happy to answer them or engage. And you can share my email. You can put it on the podcast, but it's Chris, CHRIS at zenfossil.com. It's a personal email. If you have I've been having trouble responding to Gmail addresses for some reason through that, but I'd be happy to try to answer anything. I look forward to dialoguing and putting together networks. I know there's a lot of, like, I was part of our wellness group at the hospital, and there's a lot of things out there. Like the AMA has different levels, gold, silver, and bronze level of wellness or awareness. I think Stanford's got some great programs for wellness officers, and there's a lot to be done, but you really need the support of the institution and more than just like a gentle nod in that direction. I mean, you can accomplish some things, like the things that we did that really made accomplishments were things like giving women a place that were lactating to, I mean, lactation pods in places during the busy day and giving them the time to do that. I mean, for me, that was a really positive thing that came out of it, that we've created some spaces around the community. And these were a team of people driven by our wellness officer at the time. but just places to eat lunch and to get outside. And some people can't get outside at lunch. Like in the hour, you can't really leave, you just eat on the fly or grab some food. So there are a lot of these things that not everybody can get to. And another thing I guess I'd throw in there too is that I'm talking about healthcare providers, but I think management, people at all levels are suffering from the system that we work in. And we tend to focus on the providers, but there are people by our sides that are dealing with the exact same things, the pressures, the financial situation, problems with the children. And, again, I think having an ability to calm your mind, having an ability to get out of your head, having an ability to see things clearly, compassionately, can go a long way for everybody.
Yeah. Dr. Chris Peterson. Chris, thank you so very much for joining me today. I really enjoyed the conversation.
Thank you, Jean. I appreciate you reaching out.
Thank you for tuning in to Taking Healthcare by Storm, Industry Insights with Quality Insights Medical Director Dr. Jean Storm. We hope that you enjoyed this episode. If you found value in what you heard, please consider subscribing to our podcast on your favorite platform. If you have any topics or guests you'd like to see on future episodes, you can reach out to us on our website. We would love to hear from you. So until next time, stay curious, stay compassionate, and keep taking healthcare by storm.